Chapter 18, Fasting in Chronic Disease. I have lost my appetite. Nothing tastes good to me anymore. I eat only as a matter of routine. I suffer with distress after every meal. These are some of the complaints of patients who suffer with some chronic form of disease, such as colitis, chronic gastritis, hay fever, asthma, arthritis, nervousness, stomach ulcer, or cancer. These people eat only because they honestly think that they must eat regularly, every day, 3 times a day, to stay alive. Some of them are overweight, but great numbers of them are thin and remain so, although they may be overeating. Another class of chronic sufferers are, as they put it, always hungry, quote unquote. They eat at all hours of the day and night. They habitually overeat, whipping up their jaded sense of taste with condiments, strong flavors, and in other ways. Often they suffer after each meal, but they don't cut down on their intake. Then there are those among this class who suffer almost as much when they do not eat as when they do. Hunger, quote unquote, here, as we have seen in other cases, is not hunger at all, in the true sense, but a morbid sensation or set of sensations mistaken for hunger. It may be a gnawing, quote unquote, in the stomach, pain in the stomach, or some other symptom of gastric irritation. This is the reason the sensation cannot be satisfied. The fact that eating palliates the discomfort for a few moments does not prove that food was actually needed, and more than the need for a cup of coffee is proven when it temporarily relieves a coffee addict's headache. The fact that eating palliates the discomfort for a few moments does not prove that the food was actually needed any more than the need for a cup of coffee is proven when it temporarily relieves a coffee addict's headache. The surest, simplest way for those who are always hungry to overcome their supposed hunger is to fast. Man tends to abstain from food when under great emotional distress. Rejection of food is frequent among the insane. Although the present practice to use force to feed mentally ill patients, it is the present practice to use force to feed mentally ill patients, it is doubtful if such enforced feeding is proper. Man instinctively fasts under certain conditions, as do the lower animals, and the rejection of food by the mentally ill is probably an instinctive act that will, if not interrupted, prove very beneficial. Indeed, my experience with such patients has convinced me that this is true. The most important feature about fasting in chronic disease is the marked acceleration of elimination that it occasions, thus speedily freeing the body of its accumulated toxic load. The disappearance of symptoms, sometimes of years standing, when one fasts, is often dramatic. Fasting provides opportunity for the body to do for itself what it is unable to do under conditions of surfeit. Surfeit makes impossible the cleaning of the fluids and tissues in a physiological house cleaning. A properly conducted fast will enable the chronically ill body to excrete the toxic load that is responsible for the trouble, after which a corrected mode of living enables the individual to evolve into a vigorous state of health. It should not be thought that eating must be continued so long as the body does not vigorously rebel against food. When there is functional impairment, symptoms of impairment, sluggishness, and unease, then is the time to institute what may be described as a preventative fast. A fast at this point need not be long. Improvement is often swift, preventing an evolution of serious sickness. When we observe the eyes become brighter, the skin fairer, and the breath sweeter while fasting, or when we see a poor complexion clear up, or other symptoms fade and vigor return, we can be certain that the fast has enabled the body to carry out a preventative house cleaning. It is a mistake to expect one fast, even a long one, to be sufficient to enable the body to free itself of the whole of its accumulated debris. A lifetime of piling up toxins cannot be corrected in the span of a few weeks. In such diseases as paralysis adjutant, arthritis, a large tumor, and other conditions that require so much time to build, 3 or more fasts are often needed to obtain all the improvement possible in a particular case. Sinusitis is inflammation of the nasal sinuses. It would have been called a catarrhal condition by our fathers and mothers, but the tendency today is to discontinue the use of a general term like catarrh and to use so-called specific terms. Sinusitis may be either acute or chronic. Most people have some inflammation in one of more parts of the mucous membranes of the body. That is to say, they have one or more catarrhs. Names of catarrhal inflammations vary with the different locations, but it is all the same disease with the same general cause. The practice of classifying each local inflammation by a different name and giving an individuality confuses both the patient and the physician. This keeps alive the delusion that there are many diseases. Replying to the charge that fasting lowers resistance to disease, Dr. Wager says, quote, "I have seen many cases of infection of different kinds recover completely on a fast. Take for an example an advanced case of sinusitis after 5 or 6 painful operations, frontal, ethmoidal, and antrum, with surgical drainage and irrigations 2 or 3 times a week continued over a period of 2 to 5 years with no relief or amelioration of symptoms. After almost unendurable suffering, such patients are, as a rule, thin and physically and mentally depressed. When they make complete recoveries after a prolonged fast, as the great majority of them do, is this not sufficient proof that fasting somehow or other raises the power of the organism to overcome infection, rather than fasting renders them more susceptible? What is true of sinusitis is equally true of other infections, even those so situated anatomically that they cannot be surgically drained, and must therefore be absorbed." Unquote. What is here said of recovery from sinusitis is equally true of recovery from other inflammations in the respiratory, digestive, genitourinary tracts, and other regions of the body that are lined with mucous membrane. Thus, otitis, conjunctivitis, gastritis, duodenitis, ileitis, colitis, metritis, all have been known to clear up during the course of a lengthy fast. Only in comparatively rare instances are 2 fasts required. Hay fever and asthma, both belonging to the same group of diseases, quote-unquote, are remedied by the forces of the organism during a fast. Extensive experience with fasting in a wide variety of diseases, running over a period of more than 130 years, and involving the work of hundreds of men and women, caring for many thousands of patients, has demonstrated that when the load is lifted from the digestive organs by fasting, all of the energy of the body is transferred to the organs of excretion, permitting full use of these organs and freeing the body of an accumulated load of toxin. What the body can do for itself in the way of restoring normal function and full vigor when the toxic load is lifted has to be seen to be fully appreciated. Speaking of pernicious anemia, Tilden says, quote, "A fast of 2 weeks without anything at all except water will improve anemia condition by increasing the blood corpuscles, sometimes by 500,000 in that length of time. There is poisoning from the digestive tract in all of these cases, and it seems most likely that this befoulment of the blood with sepsis from this source is the cause of the failure of the blood-making organs. A similar septic befoulment seems to exist in cancer, causing anemia in this condition. It should be emphasized strongly that no person suffering with anemia should undertake a fast except under competent supervision. There is an equal need for experienced supervision of the diabetic who fasts. The diabetic may safely and profitably fast, particularly if he carries considerable weight. If insulin has been taken over an extended period of time, fasting is rarely recommended. The sufferer with Bright's disease may also fast with great benefit. Both of these conditions and all similar diseases, more important than the fast is the correction of the total way of life. It is imperative that these patients be taught how to eat and they learn their individual limitations and to respect these. They may evolve into good health, continually improved health, if all enervating habits are discontinued and the patient learns the laws of proper eating.